week 3 and quarter 3 of nursing school.
Hi, I'm Maria, and you're watching The Registered Dad.
Nothing much for biostatistics this week. However, we started using this program called SPSS, and it's more like SPS Yes, because we learned how to make charts from thousands of data entries, and I thought it was quite fun. In psych, we learned about trauma-informed care, anxiety, and OCDs. Then we have our first test next week. In adult health 1, we had a 35-question math dosage test, in which we needed a 92% at least to pass. Thankfully, I passed. Dose over half, come in clutch. To top it all off, we had a lecture after the test. We love to hear it. We talked about autoimmune diseases, gerontology concerns, and substance abuse in older adults. During break, we played Jeopardy to prepare for the test next week. Yes, we have 2 tests next week on the same day. Guess which team I was on and which team Mandy was on. Let's just say I should have been on team 2, or maybe team 1 lost because of me. I am truly sorry. For travel this week, the whole university held a memorial service for all the families who had loved ones donate their bodies to the university. At first, I was like, what is this service about? And then a current medical student shared her thanks of receiving a kidney transplant when she was a kid. And now that she's in medical school, she's working on cadavers, learning how to save lives herself. It was so cool. In Adult Health 1 lab, we learned about catheters. I cannot help but when practicing on the mannequin. We learned about sterile fields. Here's me trying to open the sterile gloves with one hand so that I can film it for you guys. We also learned how to set up the IV pumps and wound packing. Excuse me. And that's all I have to say about that. Lastly, but certainly not least, I had my first psych rotation at the preteens unit. And it's just wild to think about. At my last job, I've encouraged so many parents to send their kids to this facility. And here I was on the unit talking to the patients. It was just a full circle moment. And I was pretty nervous for this psych rotation. I'm not gonna lie to you. The thing that helped me really relax was just talking to the patients. They're just people, man. So I look forward to the weeks to come and the reflections to be made. Then we ended the shift bonding with our clinical group, Group 4B, 4 Best Group. And that's all I can remember for